The General Hospital has once again been certified as a baby-friendly hospital by the Pan American Health Organization, PAHO. The certification was awarded following a one-week visit by a 5-member team from PAHO, which determined that Grenada adopted the baby-friendly hospital initiative that involves practicing all the 10 steps to successful breastfeeding. PAHO Regional Advisor on Food and Nutrition, Dr. Audrey Morris, explained the process to gain certification.
For a hospital to be designated baby-friendly, it should be following the 10 steps to successful breastfeeding. So in an assessment, what we do is visit the hospital and we ensure that all the 10 steps to successful breastfeeding are being followed in the hospital. You have to pass in all the steps, so I would say this time we really focused on 5 steps, and they are sufficiently following the steps in all of them. So I'd like to say congratulations to the hospital for that.
The 10 steps to a successful breastfeeding include an assessment of the breastfeeding practices in Grenada, training of professionals to be certified to be breastfeeding trainers, the training of staff in breastfeeding techniques, and producing brochures and posters to reinforce the importance of breastfeeding at health facilities.
They should keep up what they're doing in training staff so that the staff can in turn educate mothers. They can maintain what they do at the hospital, the birth practices, for example, that are supportive of breastfeeding, so such as placing the babies in immediate skin-to-skin contact with the mother, letting them stay there for a while, and then mothers can detect when their babies are ready to begin breastfeeding.
And with this certification, what does that mean for, or what can patients, mothers, and babies expect with this certification?
Right. So it means that they expect that everything will be done to ensure that they have a comfortable experience at the hospital where breastfeeding is concerned. They are helped. They're shown what to do. Of course, this starts from when they're doing their antenatal care, but they would be assisted in every way. They're shown how to position and attach their babies, how to know when their baby is getting the milk, how to know that their baby is growing well on the milk, all of that.
The Baby Friendly Hospital Initiative was launched in 1991 by the World Health Organization and UNICEF and is aimed at promoting and supporting breastfeeding in health facilities that provide maternity services. Acting Ward Manager at the Obstetrics Department of the General Hospital, Jeanette Mitchell, says the nurses are ecstatic about the recertification.
The process started in 2015 when Grenada embarked on becoming baby-friendly and the baby-friendly initiative. So we had ongoing training, intense training for staff members. All levels of staff members were trained, and we were assessed in 2019 by PAHO. We did not pass all the steps, so we received a certificate of commitment. Later on that same year, we were reassessed, and we received the certificate of baby-friendly initiative. Reassessment was done in 2023, only in 2023, and we went down 1 or 2 steps. We went down. So PAHO is here again now, and we just received the certificate. We just received our baby-friendly hospital initiative certificate again. So we have passed again for the second time, and we are so happy, we are so elated.
Nurse Mitchell says the BFHI's aim is to give the best start in life to all newborns by creating a healthcare environment that supports breastfeeding as the normal, natural option.
Not because we pass, we just gonna stay right there, but we have to continue walking the steps. It's 10 steps. We have to continue the training, continue the teaching and supporting of mothers, and all the steps, that everything that incorporated in the steps, we have to continue practicing. We're not going to become complacent. We have to continue doing what we did to pass and maintain it.
The certification comes 7 years after the launch of Grenada's breastfeeding policy, which is a guide to be applied by all staff providing maternity and neonatal hospital services to pregnant women, mothers, and their babies. Reporting for the Ministries of Health, Mental Health, Wellness and Religious Affairs, I am Blossom Alexis Welsh.